Hi there, it's Dr. Lisa Smith here from Errol Street Chiropractic in North Melbourne. And if you get really confused when people talk about disc issues, herniations, prolapses, or you've got a disc issue or someone that you care about and possibly lots of leg pain or sciatica, then stick around because I'm going to go through and help you to understand a few things. So I'm going to help you to understand some of the words around disc issues, how it can actually affect that nerve, and when we need to really worry about it in terms of getting surgery done, and what caused it, what's caused this problem in the first place. So unless it's an obvious accident, which some are, but not all of them are, and people are usually shocked, like, how did I get this this disc issue? How have I got disc degeneration and disc disease? So stick around and we're going to go through that and help you to understand that very, very shortly. So I'm Dr. Lisa Smith from Errol Street Chiropractic in North Melbourne, and we get loads of these questions on a daily basis. So this is just to help to clarify and give you a little bit more information. Now, when people come to us and they say, "Oh, Dr. Lisa, I've been diagnosed with a disc prolapse," and I say, "Okay, well, how do you know you've got a disc prolapse? What kind of studies, what kind of tests did they do?" Well, I've just had an x-ray, or they've done a couple of reflex tests, which is great, and we need to do those. However, that's really not enough to diagnose a disc issue. Okay, so really you need deeper, more detailed scans, like an MRI scan, to really know if you've got a disc issue. Okay, so unless someone has had an injury where they've got such severe back pain, and they usually will get all these tests and scans done that they know they've got a disc issue. Most of the time, disc issues are a problem because of your biomechanics, because of how your spine is sitting, because of how your spine is moving. Nothing to do with your age. It is how that spine is loading. So we know with research that a lot of disc problems come from a lack of curve in that lower back. Okay, so that side curve is there to absorb the shock. So it's that forward curve in that lower back. Now, if we don't have that nice curve sitting at 40 degrees, then we're going to load those structures. We're going to load the discs. So the disc is that bit of material in between the vertebra, okay? And it's got like a little ball bearing in the middle, which helps with movement. And then it's got the annulus fibrosus around that. And that obviously creates the rest of that disc. Now, if the forces are not even, it's like you walking on the outside of your shoe for long periods of time, you're going to wear out the outside of your shoe. So where your spine should be straight, kind of, this one's a little bit crooked, looking at you from front to back, if you've got to shift, you've got to shift over to the side, what's going to happen? We're going to start loading up these discs and tissues. We're going to have compressive forces on one side, and we're going to have these stretching tensile forces on the other. You walk around like that for quite a while, what do you reckon is going to happen? We're going to have, that ball bearing shooting off to one side, okay? Now, disc bulge is when we've got a little bulge in that disc on the outside. So no tears, all right? So this can actually interfere with that nerve, because you can see how close that disc and nerve are to each other. So a little bulge there can irritate that nerve and cause some sciatica. So what do we do? So if it's due to changes in your biomechanics and shape, then we obviously need to work on correcting that, and that's where chiropractic comes in. Now, what happens sometimes is that the disc, if it's there long enough, okay, and the loads just keep happening, what happens is that we can actually get a disc herniation. So it kind of gets a bit more serious. It's like another level now, where that disc, that ball bearing, which kind of looks like that in the center, okay, that can actually push through those fibers and then hit that nerve, or worse, it can actually go through the spinal canal in the center. And if it's really serious, it can seep into that. It's called sequestration. And it can tear through the ligament, and that's more likely a surgery case. But if we leave it long enough, it'll eventually become a surgery case. So we want to get on top of these problems early. So what happens is that we need to understand that there's a very close relationship between your spine and your nervous system. Your nervous system is what runs you. It runs your organs. It gives function to those muscles to allow you to move. But when the discs are an issue, I just want you to see how close they are, okay, to the nerves. But also what happens when we start to get discs degenerating, then they get smaller, and when the discs get smaller, there's actually less room for those nerves. Now, that is obviously a problem that's been around quite a long time, okay? So, we really want to make sure that we don't get our spines to that stage, but we would still benefit enormously from making sure that all those spinal joints are moving well, and that we can help to correct that spinal alignment and get that spinal closer to ideal, straight front to back, and the proper curves looking at you on the side, not to add further stresses and loads to that spine that's already got an issue. So chirobiophysics really helps to do that. Now, if you need a bit more information about what we do here at Errol Street Chiropractic, just message us below here. And if you enjoyed this information today and would like to pass that on, please share. And otherwise, we hope you've got a bit of extra understanding about discs and problems like that. So thank you guys for listening, and we will see you next time. Take care. Bye for now.